Evening. We are back at Fridays Live with Psyche. I am Vishali. I am the founder at Psyche Unlock Psychology, and I am so excited to see all of you here. Today we are going to interview our PDP trained student Huria Sheikh, who is a clinical psychologist, NLP coach, and a psychotherapist practicing in Pakistan. And yes, that's what we're gonna do. If you do not know me, my name is Vishali. I'm the founder at Psyche, and what else? Let me tell you about the mission and vision of Psyche again. We at Psyche Unlock Psychology want to empower counseling psychologists. We are on a mission to make every master's in psychology graduate employable with the right skills and techniques, and which is why we provide training into psychotherapies and counseling so that you can become a confident counselor. Today we are going to interview one of our trainees, Huria Sheikh, who has begun her own private practice. And she's going to share a lot of tips and tricks of starting your own private practice. What does it look like? How to make it profitable? And any other questions that you might have, I would like all of you to drop the same in the comments below. What else? Yes, one more information I want to give you is that we have a free workshop on how to become a reputed counselor, a 3-day workshop series on this 16th, 17th and 18th of June. If you have not yet registered for it, what are you currently doing? Please go to Psyche's bio. There is a registration form. Please fill the form. There is a WhatsApp group link. Please join that. I'm sharing a lot of things in that WhatsApp group, pre-session mini trainings, and we will be meeting live on 16th, 17th and 18th. If you are someone looking to become a reputed, confident counselor and want to work on your skills, this workshop is going to give you the same roadmap that many of my PDP trainees have followed to become confident counselors. Now let us invite Huria. There she is. Free to ask any questions that you might have related to counseling psychology. Huria would be more than happy to help you with the same, and any questions related to private practice. Hi Huria.
Hi. Hi everyone. Hello ma'am.
How are you?
I'm good. How are you?
I am also good. It's so good to see you after so long.
Same here.
Perfect. Huria, would you like to introduce yourself? I have already told them you're a clinical psychologist, but please tell us more about yourself.
All right. So I am Huria Sheikh. I'm from Pakistan. I am a clinical psychologist. Now also even an NLP coach. I'm going for the master level. I just did the practitioner level. And I'm also a psychotherapist. Currently, I've just started my own clinic. And it's been a month and it's going great.
Awesome. That's amazing. I mean, that's what we actually want, right? The confidence that you have, and I think everybody wants to begin their own private practice. That's like a dream for so many of us.
Yeah,
so
definitely.
Tell us more about, how did your journey in the field of psychology started? How did you came into the field, and the journey from there to starting your own clinic? So, yeah,
All right.
why psychology?
It's a long journey. Why psychology? I think I was very fascinated. Since the first year, I've been sticking by psychology. I took it there and I knew this was going to be my major. I had sociology with it that time. And I was confused whether I should go with that. But sociology didn't fascinate me exactly. This was, the study about mind and behavior. And that was fascinating for me. And from first year, I've been sticking with psychology and I never left it after that. And I think I knew very early that, this is what I'm going to do. And then I did my, bachelor's in it. Then I did my master's. Then I said, let's go for MPhil. And after MPhil, so I think you can say there was no stopping me. I kept going for it. And then, I found you guys. And then there was no stopping for going for the clinic eventually. So it was a great, great journey, I would say.
That's amazing. So, perfect. So, mainstream. So, no specific reason for choosing psychology?
I would say not really. Maybe this also, that when you are a growing teenager, you yourself need something, to hold on to or to feel better or to look up to. So I would say maybe you're looking into your own behaviors and you're trying to find your own self somehow. So psychology sort of gave me that direction that I think this I might be very good at eventually. So that's why I've been holding on to it. And that's the only reason I never left it. And like I said, I was confused with sociology because sociology was also a very good subject. But psychology had like its grip on me, and it kept on fascinating me as the more I studied it, and I would miss classes and bunk classes of other subjects, but I would not bunk classes of psychology at all. So I knew there and then, KSK class I'm not bunking. That means this is where I'm going. Yeah.
That's like you being very honest.
Yeah.
Perfect. All right. So, Hurriya, tell us, after you completed your formal education, how exactly did it look like? Since you are from Pakistan, so after completing your MPhil, what next? What did you do after the same?
Actually, after I did my MPhil, I did know that I have to go for I go for internships, and I went to different hospitals, and I had to correct cases, collect cases for our data and everything, and the submissions and everything. I did like 35 cases in my MPhil, and you had to type them and write them. And in the hospitals, when I was going around, the hospital I was working was for less privileged, and working there gave me so much comfort. And it kind of felt, when they would just praise you, they don't have to pay you. They're, working in such a hospital where their finances are taken care of. But when you work there and they praise you, they would pat you on your shoulder or say thank you to you. And I was like, this is great. And I think I'm good at it. Eventually, by doing internships, I did learn that I'm actually good at this, and this I would like to pursue. And I got married, and even after that, I was like, maybe I will not be doing this, but I did. And I could not stop myself from working, and then doing different diplomas and different certifications to enhance my skills. So I think that when I was working in the hospital and I was doing internships, I knew that this is something that is going to help people a lot. And it was very much needed in Pakistan, in both of our countries. I think mental health is not much talked about or cared about. You would take care of the physical health so much, and you would not worry how the mental health is going. And in our society as teenagers, we're suffering from a lot of problems ourselves. We're going through bullying and whatnot. And I think I knew that this is something that will help me and will also help others. Yeah.
Very true. I relate to you so much.
Yeah.
Very true. People are finding you so inspiring. Already. Perfect. So, Hurriya, tell us, how did you came across Psyche and, PDP for that matter?
You don't know, of course, the story. I had a friend, Nida, and she recommended it to me. She did it, and I'm very close to her. She's a great friend, and she's a great psychologist. So we had been doing internships together in the same hospital that I was talking about. And she mentioned that she did it, and she told me this. She goes like, whatever we have studied is waste. Okay, this you have to do. Why? Because you have no idea what she teaches, and we have not been taught this. So I was like, she said, you did MPhil? Consider your MPhil as nothing. Because this, what she's going to teach you, you're going to learn interventions, and you're going to actually learn how to apply them, which we've never been taught. So I was like, okay, she's talking so great and everything. And if you remember that I missed the actual date of joining. And she was like, I was like, I'm late. And I was like, I don't know, but I'm going for it. So she actually told me that you meet me once and I will tell you how good these interventions are and how much she has learned from that. And kudos to her for recommending. And, here I am. And she did it. She was so inspired. And she thought that her life had taken a turning point or something, and it has changed. So I was like, maybe this is exactly what I need, because I was thinking of starting my clinical practice and I was very hesitant. I was worried that maybe what if I'm not able to produce that results in my patients, and what if they don't get what they want? So and the thing that I was lacking was my confidence in my skills. So maybe I thought maybe I should do this so that I can enhance my skills. And that's what Nida told me, that this is about skill development, basically. So I was like, this is all practical knowledge, and that's exactly what I need, even though I had worked, 3-4 years at a rehabilitation center, and I was dealing with all of those patients. But still, starting your own practice makes you a little bit, you're like a little bit worried what will happen, how it will go. So then I was like, I think I will go for this. And thank you to you. It helped so well that I instantly started my clinic right after. So it was brilliant.
That's so amazing. People are literally in love with you. So there is Hadia and there is Kretul. Kretul is saying we need Nida also in our lives. I want to interview Nida. Let me catch her. So next I'm bringing Nida. Nida as well as Javeria. So both of them had joined together.
Yeah.
Hadia is saying we definitely do, and we surely need more Hurriyas as well. Absolutely, very true. The way Hurriya is changing lives is amazing. So people are in love with you, Hurriya, somehow, in no time.
Oh, that's great.
So, Hurriya, tell me more about, you're saying that you already came with 4 years of experience. You had MPhil in clinical psychology.
Yes.
What value could PDP add to so much of experience and qualifications that you were already bringing? So PDP,
Uh,
did you learn something new or
yeah,
was it
yeah.
all the same?
So much new, a lot, I would say. First, the amount of therapies I learned. There were like 12 therapies in it. And 12 therapies is going to give you so much, skill and equipment that, okay, if this doesn't work, I can go for the other one. Like, for example, we are always applying CBT everywhere, like I had gone through CBT a lot. But like when I learned SFDBT, so I learned that you can make them focus on the solution sometimes, especially when clients come and they're just talking about their problems. There's like a list of problems, and then you can be like, what are the solutions? Let's talk about the solutions more than talking about the problems. So SFBT was a great, and then positive psychotherapy was great because focusing on the positives of your life, not only all the things that are going wrong. That was a very good perspective to go with. Then graphotherapy I had not heard about, and it was brilliant to learn about. And even now, when I give my clients and my patients homework, they do it, and then I'm going through their writings. I remember even sending you my patients, a little bit, asking the little questions, queries, whichever I had. And I remember you told me that, did you do their handwriting analysis? I was like, well, why am I not doing that? I was in love with graphotherapy. Why didn't I apply that yet? And then I started doing that, and I could find that that is going to help. It was helping in correlation of the material that, whatever I've heard from them, then it was helping me what changes I might need to direct them towards. So that was, great. And then, after 4 years of experience, I was still feeling like I don't know how to go about my session to session. I don't know how to see the progress in a client. When first session comes, okay, this is what it is. We have to give them insight, or we have to give them awareness of the problem. But then what? Then what is the next step? Which interventions to use, and you taught us so many interventions that I had backup. If this is not working, I knew I had more that I could go to. So which was brilliant. And honestly, I didn't learn this in MPhil. We learned about CBT mostly, and I had heard about DBT, and we would go for eclectical approach. But well, for eclectical approach, I need more therapies, which you guys didn't teach me. So I needed those, and I got them from PDP, of course. And now I have so many ideas and so much interventions and so much to do with my clients that sometimes I'm like, which not to do? So that is what I wanted. Yeah.
That's amazing.
Yeah.
Another thing, Bhuria, I want you to highlight is the teaching methodology. So was it similar to other online courses that you've probably done, or maybe if I say, was it theoretical in nature or was it really practical?
No, it was not only theoretical. I remember our first day used to be theoretical so that we had a background knowledge of everything. And after the second day, one therapy would go on for the 5 days. And then I remember that it was all practical. And that was the best part. You were even teaching us how to implement all of those on ourselves. And I had a lot of insight and self-awareness through them. And it helped me with a lot of my own problems, And the breakout rooms were brilliant, because we would go into the breakout rooms and you would, make us apply it as a therapist and a client on each other. Basically, what exactly is needed when you're going with a patient, you are hesitant how to apply these. So if you have practice of that, that is what we want exactly. So when we're practicing, taking turns that I'm a therapist now, you're a client, and let's just apply those. And a lot of, I would say, life-changing moments also happened during those, which was brilliant. And for me as well, not for other people maybe, but for me at least they did. For other people also, I know they did. So, because everybody was very happy about how things were going. And no, it is not like, I was scared. Honestly speaking, I was scared that how can somebody teach something online, platforms, and how will it be? Then I didn't even know more, like the features of Zoom or anything, that there was a breakout room option or we could work around that also. So I would say, no, I was very hesitant and I was not sure. And it felt like a proper classroom. It was like proper question session, and then you giving us time at the end to ask the questions and going around with every therapy step by step. And we would ask you where to implement those, on which clients, which sort of disorders this can be done on. So everything was very sorted and planned, which was brilliant on your part, because that's exactly, we were looking for something solid in direction and practical knowledge basically. And that we got. And that's why I came, I would say. And which is, I got that completely, fully. Yeah.
Amazing. Thank you so much, Surya, for throwing light on that. Now, our audience really love, the case studies. So
Yeah.
because you've learned so much and you're practicing, and guys, the kind of videos Surya posts on her Instagram page is literally brilliant. Even I listen to them every single day. They're very insightful. So if you wanna connect with her, please follow her page, Breath Brace Blossom, and it's really good. So I really feel very happy every time I see her video. She's working on her, branding as well. So that's like kudos to you, Huria. So tell
Thank
me
you.
more about the kind of cases that you're seeing. How are you using everything that you've learned inside PDP to help your clients? And what is the aha moment that your clients get with you?
Okay. First, so even if you look at my videos, I have had a few things from our own 12 therapies, just the sessions and everything, the metaphors we had used and the things that we had discussed. I had used those for even my videos. They were very good. Actually, they were working wonders even with my clients. So I had like an international client come, and which I was very happy about because that was my first international client. So he came and, he had OCD. And initially, I asked him, I remember I used CBT's technique of what is in your control and what is not in your control. And he goes, right, that OCD was in the list of it is not in my control. I was like, why is this not in your control, So the thing is that I made him understand, gave him insight that this is under your control because OCD is not only genetic, it's learned basically. He learned it from his mother and she had OCD and he learned all the behaviors and he adopted them. So I was like, this is in your control. You can, work on this. So first that was a awareness or an insight sort of a session for the first one. And then after the last session I had with him was brilliant for me because he came and he was telling me about the things that were going right in his life. And then I made him realize, I was like, do you know that first time you came, you were telling me the problems and the list of things that were going wrong. And this is our fourth session, and you're telling me all the things that are going good in your life. So I could see that he had changed his negative thinking patterns and he had started focusing on the solutions of the good things of his life. And, I made him practice gratitude. I did cost and benefit analysis with him, that what are the benefits he's getting out of OCD. And he was like, of course, he's not getting many besides the thing that the house was clean. And besides that, he thought there's nothing that he's getting out of it, of course. But he was like, yes, I like the house clean. So then I asked him also to identify whether those habits were him or they were OCD. He had to differentiate between both of them, that this is his attitude and the things that are part of his personality. And then these are the things that are not part of his personality. They are basically OCD because we only want to get rid of the things that are OCD, not the ones that relate to him or feels like him. So that I made him understand. And this I, of course, learned from PDP because I learned that we are supposed to tell them that they are not the problem. The problem is separate and they are separate. So they need to separate the problems from themselves. So which worked wonders. And then I did the leaves in the stream mindfulness technique on him, and which he really liked because he was, you have to read your patients. He really was into visualization. He said, I can visualize things. So I did leaves in the stream with him. So I was like, if he's good with this, I should go for mindfulness maybe because that will work wonders on him. So you have to sometimes read the language of the patient, that whether he's a person who is better at visual or he's somebody who's going to do things better with when he listens to things. So that was I would say it was a very good learning session for myself. I could see my strengths and I could see how I was doing. And, just doing PDP helped me in this way that I would know what to say, which I did not know before. I knew which questions to ask. And things when I was talking to him, it would pop up in my head. Why? Because I had this skill-based learning. I had that practical knowledge which I could utilize. So I would say that after that, I worked on the behavioral activation that you taught us. Then I gave him tasks, and one task I gave him was very wonderful because he's into cleanliness. He has OCD of cleanliness. So what he did is he used to make up the bed every day, wake up and wash the dishes and mend all the house and everything. He has a wife and kids, but he's doing everything and anything. He would step home and the first thing he would do is fix his home. Not even go wash his face or, rest a little bit or take a coffee or something. No, he would instantly get home and try to fix anything. So then I gave him behavioral activation tasks that he has to unmake his bed when he goes home. So he's supposed to, ruin his room, basically. So he went and he did that. And I said, you are going to stand there and you're going to watch it for 5 minutes that you did this. And then you're not going to fix it and you're going to get out of there. So, that he did it and he messaged me. I watched it and I did it, and I read the message, and I could tell the enthusiasm in that message, that he was so proud of himself that I was able to do that. And honestly speaking, I was proud of myself, and how did I make him, get there? So, which was brilliant. And I would say this case has a little bit of a special space in my heart right now, because I think that this case has shown me, this patient has shown a lot of progress. And I could see that he was so much better in just 4 sessions. And yes, of course, there are individual differences, and not everybody is going to go with the same pace. Every patient is going to go through different, pace, and it's okay if they're not making those drastic changes, because that happened with a lot of clients otherwise. This client was showing a lot of progress. I had a patient who I was struggling with, where I was messaging you because the problem was actual. When the problems are realistic and they're happening in their life, like even if there's domestic violence or bullying or abuse, when they're facing them currently, it is hard to give them a sense of direction or tell them what to do with it. And I was struggling with that. And then I, of course, asked you that what I need to do with him. And I think that we need to understand that we cannot be perfect. And we need to understand that it's okay if we are not probably able to make those drastic and big changes all of a sudden in them. We can take our time, read the cases, make the session-to-session plans, and then go about it. It's okay if we don't make, big changes instantly. So it's okay. I hope this case study helped.
How proud I feel, Huriya, the way you have literally, I've interviewed so many people in the past, and I'm sure they're also using a lot of techniques. But the way you have combined every therapeutic technique which you have learned inside PDP to help your clients, and you've gone beyond the conventional method of just CBT, which most of the people most widely use, is brilliant. And the kind of changes that you're bringing in your clients is amazing. I mean, I have spoken to a lot of people, but you have listed like so many techniques in just one go, and it's really good because this shows the amount of brain application that you're using when a client is coming to you, because almost everybody learns the same thing inside PDP, but everybody uses different combination. And this brain application that you are doing with your clients, I think that it is helping them a lot. That makes me very proud.
Thank you, ma'am.
Thank
you so much.
Page is Breath Brace Blossom. So if you will, Arvindji, see on the top, you will see 2 pages. One is Psyche _ another is Breath Brace. So you can simply click on that and click follow. Or I'll send you personally as well. Perfect. Is there any other question? There are certain questions. See, if you, I'll take the question and then Huriya will continue. Is that okay?
Yeah, definitely.
Perfect. PDP is professional diploma in psychotherapies that we provide here at Psyche. Another question that somebody has for you, Huriya, is how to work for mental health promotion right from college days. I'm currently a psychology student. I feel that there is a lack of awareness in you. One, I think you can connect with counselors like, clinical psychologists like Huriya. And 2, I think Huriya will answer.
Yeah, I would say if you want to start up from college, you're thinking that first, when you enroll into psychology itself, you are going for the help that you're going to give somebody in the future. Because when you're enrolling in the subject, that means you're going to turn into a career later. That means that you're on the right track already. Why? Because if you're studying about it, you're knowing about it, you're going to implement it on yourself, then you're going to probably help the people who are around in your family, your friends, or everybody, right? And then eventually when you will get the degree and you'll work around it, you'll do internships and you'll do job, and all of that will follow. You will be actually doing everyone and yourself a favor, of course, because there are very few people who are studying and then actually going for the career. I know a lot of people who did study it, but they didn't end up, going for the career. Otherwise, I can say, of course, you can post, like when you see some psychologists posting some good stuff, you can post that on your pages or on your Instagram handles and everywhere, so that it becomes like an awareness thing and everybody's talking about it, and maybe normalize talking about it. Talk to your friends about it. Maybe give them the space that it's okay if you're going through something. Giving the acceptance is itself a lot of work, I would say. If you're accepting other people for who they are and if they're going through something, from your college or young life, I think you are leading them and you're making life easier for them. That is what mental health is about, supporting each other, right?
Absolutely.
Yeah.
True. And I really like the idea of sharing the content that other counselors are posting, because I think that's the most authentic content that you can find out there, beyond textbooks and more. And
If
of
they're in
course,
college, they might not know much. So posting something that is authentic or coming from a mental health professional is going to be great help. Yeah.
very true. Absolutely. So, Huria, coming to the private practice, because of which so many of them are here. So you mentioned how you're utilizing everything that you learned inside PDP for your private practice and so on. I want to understand, did you always want to begin your private practice, or did it something that came up, abruptly? And how is it going? So tell us more about it. Is it easy? Is it tough? Share your
It
experience
was,
about the same with us.
yes, it was a long run plan. Yes, it was always in my head that I want to go for a clinic or a wellness center or even a hospital after all. So that was what the plan was. But that plan came after I did my MPhil, I would say. Not very early on because you're still struggling with your studies and there's so much to do and so much exams and everything and the cases and everything. No, not at that time, yes. Yes, I would say after MPhil, I knew that I think I would want to go for that, especially when I started my first job. So I would say that if you're trying or thinking that I want to go for a clinical practice, there are a lot of steps before that. You have to first, get a good enough degree, right? And then equip yourself with different skills by doing such diplomas, like, going for PDP help or taking some certifications so that not for the sake of certifications, of course, for the sake of upskilling yourself, and to equip yourself better. Even right now, when I am doing my clinical practice, I enrolled into NLP, because you had taught us NLP and I found it inspiring. And then I was like, I think I would go for a certification for NLP. Why? Because I don't want to sit here and, just do what I have learned and that's it. No, I want to keep growing and doing better and, getting more skills and everything. So I would say that first off, so you have to study something that is relating psychology, right? But after that, you have to make sure you do internships. You do job first. Why? Because you need to have some screw ups. You will screw up and you might do some, work where you're like, oh, what did I do? Or this I didn't do right. You need that training or that time where you learn from your mistakes and you go around doing stuff and you deal with stuff and especially you learn from somebody. When there's a senior in clinical practice, you are by yourself. That is a solo job. So before that, you go for a job or you go for internships. First do internships, then do paid internships, then even go for a jobs. So I would say I worked for 4 years, then I started my clinic because I knew I had made my share of mistakes. I had mentors to learn from. I had people who could tell me if I was doing something wrong. Plus, I would say that it had helped me how to deal with clients or patients with different issues when they're coming forward. Because initially, I remember when the problems used to come, we used to be shocked. Okay, I had never heard of such problem. It's so big, or how will I deal with this? Or going to somebody else and be like, I can't take this patient. This patient is so tough. No, you will go through those times. So don't open your clinical practice right away. Take your time and take your time, study well, then go take some case histories, work on those cases, try to see what needs to be done, make session to session plans for all, use those interventions and make those session plans, not even implementing them, but knowing what to do and how to do it. And then doing job first and then going for clinical so that you have experience, you are capable of working solo and you have made your share of mistakes because clinical practice is not somewhere you can make a lot of mistakes. You can have margin, but you cannot make too many mistakes because they're paying you so much for coming there and they need results and they are trusting you now. And, with a hospital, you can refer to somebody senior or you can take help. But, in a clinical practice, you don't have anybody to go to. You are on your own.
Absolutely.
Yeah.
I want to add here that Huria here is talking about clinical psychology. And, and this does not apply exactly the same for counseling because in clinical, the cases are very severe. Yeah. And she's very right when she mentions that you need to have mentorship first, some experience of seeing clients so that you don't feel very shocked when a client comes to you for the first time. So here in India, we get training-based MPhil, I think, which helps people. But again, getting experience after the same is a very good idea, which may or may not apply for counselors. And the PDP program that we provide is more for counselors and psychologists. But clinical psychologists from Pakistan take up the same. Reason being, I think it helps them upgrade a lot. I did have clinical psychologists from India also taking it up. The disclaimer that I want to provide is that we at Psyche do not train clinical psychologists for that matter because here in India, MPhil from an RCA recognized institute is the way to go about it. If you're looking to become a counselor or practice as a counselor or psychologist, then the pathway can go through PDP and so on. So that's the disclaimer I wanted to provide in case anybody has confusion that we train people into clinical psychology. But everything that Huriya mentioned with her experience is absolutely right, and I think that applies equally well for clinical psychologists in India as well as anywhere across the world. Perfect. So Huriya, tell us more about, now that you've started your practice, how is it going? I mean, how are you handling all the management staff? What are the awkward situations that you maybe have to deal with sometimes?
Yeah.
So tell us the business aspect of it.
All right. So first is this, that after I did my, practice and everything, I did work for a hospital and everything. And then I worked for a private organization as well. But after that, what happened is that first I had to see what I was good at. You have to always know what are your expertise in. When you're working, in internships, and when you're going for these jobs, you would know which clients, what sort of patients I can help better. Not everything everyone can do, right? Like, I am not dealing with suicidal patients. I'm not dealing with very severe trauma-based patients. Why? Because I think that I still lack that 100% of strength that I can work with such a client, and I don't want to go wrong with such things, because suicide and trauma are very severe, and you can't go wrong with those. So I'm not dealing with those. So you have to identify what are the things that you are probably good at or best at. Like, I know I can deal with depression, and I can deal with stress, and I can deal with OCD, and you have to know your share of, if you're doing counseling even, you have to know what sort of clients that I can deal with better. Like, I am not doing it with kids. I'm doing it for 13 and above, right? So you have to identify that I am good with kids, or if I'm good with adults, whether I want to go for this or that. So you have to define these things a little bit. You have to be clear about your niche, and you need to know that these are the areas that I'll be working on, and the areas that you're not confident about, please don't go for them at all. Skip them. You can probably upskill yourself with that, and you can work on those skills. You can take trainings or do all of, you can go for PDP and learn something from there, some interventions from there, and then you can probably go for those severe disorders or any mental health issues that are very severe.
Yes, so defining your niche.
Yes, exactly.
Absolutely.
So choose where you can work, what fields that what are the areas where I'm good at, what are my expertise basically, because when you're going to start your clinical practice, you have to advertise those, right? You have to tell them this is what I'm good at, and people usually see, acha, this person is dealing with OCD, okay, I can go to them because I have OCD, right? So if you are not dealing with those issues, like I'm doing couple counseling, but if somebody's not doing couple counseling, you can't go to them for couple counseling. That's not the right way to go to a psychologist also. So that is the first thing that you need to do. You need to be clear about what you're going to do, which age group you're going to deal with, stuff like that.
100%, absolutely. I think it's very valuable. I'll add step by step along with you. Sorry, I'm breaking your flow, I think.
Yes, sir.
So I want to tell our audience, since some of them would be new, niche means, like Huriya mentioned, a specific population that you are working with, and a specific thing that you have the expertise in. So you don't have to be the jack of all trades. If you think that you work the best with couples, you can become a couples counselor. If you think that, like Huriya mentioned, stress, depression, OCD is something that your expertise is there in, there are like tons of people out there who are suffering from these concerns. This is just like MBBS and MD. When you say I'm general, I have an expertise in everything, that's like doing an MBBS. But you know that people who have an MD are paid better as compared to MBBS because they have a special expertise. So a surgeon would earn as much as, not making the comparison, but again, defining a niche helps you a lot. And when you're defining your niche, you also need to come from a space of abundance that a lot of people are already there who are suffering from this, and who need my help with this particular thing. Perfect. So step one, I think our audience needs to define their niche, their expertise, and people they want to help with or they enjoy working with. So Huriya has her expertise with people with 13 plus years of age group. And you mentioned Huriya, stress, OCD, depression,
and I do marriage counseling, I'm doing adjustment problems, I'm doing relationship counseling, then of course I'm doing handwriting analysis thanks to you, and so that, and these are the areas that I had defined that I'm going to work with anger management, and then I had excluded trauma and suicide because I didn't think that I was first certified for it, and second, I was not good at it yet, so I didn't pick those areas. Plus, I didn't think I was good with kids. So I didn't start dealing. I even got a call where, like if you can get selfish about it, you will be like, oh, I got a call that they said that there was a kid who wanted they had tantrum issues or something, and they called me. That I was like, I don't deal with kids. So please be clear that if you're starting a clinical practice, don't say yes to things which you're not going to end up doing good with. It's a child at stake, and I don't want to deal with the child and make things more difficult for them. Yeah. So
The second thing is ethics.
yeah.
Like what Huria is saying is ethics. She's very clear about who I can help and who I cannot help. And that's the same thing that I also tell my trainees that, just for the sake of money, don't put somebody else's life in danger. Only when you're 100% sure that you can help someone, help them. Otherwise, refer them. You automatically get, eventually you're going to get a lot of people who need your help. But I really love the ethics part. So if you're starting your own practice, you need to be clear with your ethics. Next step, Huria.
Yeah, okay. Then the second thing that I did after this was that I joined your diploma because I wanted to be sure that I am skilled enough before I start. And I didn't want it to be, there's a patient coming, a client coming, and they're already questioning themselves. Imagine the psychologist or the counselor also questioning themselves. That is not a good way to go. So yes, before I started, I went for PDP and I enrolled into this because I wanted to have enough skills and I wanted to feel confident in my skills before I would started dealing with somebody's life problems, So be sensitive about this, that you have to be very well equipped before you start a clinical practice. You can't just be in a mood and go for it, It's better to go for jobs if you think that you're still not ready. And I did this PDP diploma right before, when I was thinking of starting my clinical practice. And I did it. And the next thing I knew was I was going for, starting my clinical practice. So yes, take some diplomas, go for PDP, upskill yourself, and take some certifications also. And then when you feel confident enough, then you should go for a clinical practice. Yes.
Absolutely.
And then the third thing that I did was, now if you look at my page has like 300 followers only, right? But I'm having footfall at my clinic. Why do you think is that happening? I have not much followers going on over there, but still I'm getting so many patients. Still I'm dealing with so many. Why? Because they're looking at my skills. Plus I'm doing advertisement, I'm putting up ads, I'm doing marketing for getting patients and to get to help them basically, so that they come and I help them. My goal, when you're in a clinical practice, your goal might not be to increase your followers. My goal is more that patients come to me and I'm able to help them. That is what my goal is. So yes, I'm working more on ads rather than, and yes, I did started putting up videos and I started talking, and you should have to speak up and show yourself up, and so that they know what you know stuff and you're good at it, and what sort of a psychologist you are. So you have, for even displaying your niche, you need to make these videos. So that they know what she's good at, what she's talking about. So yes, you have to enhance your page and your social medias, and you have to do marketing, and you have to put up ads and everything. Before even starting your clinical practice, you have to do the marketing part, of course. And then
I'm going to pause you again now, so that I can cover third and fourth step, and then we'll move ahead. Okay. So we made a note. First step, defining your niche. Second step, be very clear with your ethics. Third, she did PDP to upskill herself. Another thing that she mentioned is also that, with PDP, you also work on yourself first before you're taking another client in picture. Which means you as a counselor need to be very much sorted before you take somebody else's life in hand. Yeah. If your own relationships or if your own concerns are not 100% sorted, very much sorted, or if you are yourself very confused, you will not be able to deliver 100% to your client. And fourth thing, very nicely, like I already mentioned that Huria has a very good brand presence, very qualitative content on her page. And I think even if she would not have been posting ads, she would still be able to attract clients because the quality of content that's there on her page is very helpful. So 4 steps, define your niche, be very clear with your ethics, upskill yourself, work on yourself before you work on your clients, take programs which are good to upskill yourself, something like PDP that Psyche offers, and finally build a very good brand presence for yourself. Let's move ahead.
Yeah. So then after that, what I did is that, of course, first I looked around. where I would be. Area, the location really matters, which location you're going to be opening your clinical practice in. And you have to go around with finances also. You have to see whether I can own a place or whether I can rent a place, or, whether I can join a wellness center where there are other fields of doctors sitting there. And that is very much available over here. Or you want to sit at a hospital and have your clinical practice, because there are clinics in the hospitals as well. So you have to see which one suits you, right? Then you have to see, because my timings were evening timings. I was more comfortable in evening timings. So then I prefer that I would go for a, private clinical practice. So which was more helpful for me. So that's what I did. And of course, you have to see your budget and your resources. That is always going to come. And it's okay if you don't have a lot of resources, or you don't have like a bank balance that is supporting you to get a clinic. Trust me, bank balance has nothing to do with clinical practice. You can always rent a place. You can always work in a collaboration with somebody. You can work under a psychiatrist as a counselor over there, or as a psychologist over there. Even that is going to be clinical practice. Yeah, because all of these things are okay. So it's not about having a lot of budget. Don't worry. Don't think that you have to be very rich in order to open a clinical practice.
And I think online nowadays, because you can do so many things online, that's another alternative.
Yeah.
So you don't need to have a lot of funds to begin. And the options that you mentioned, Huria, are also very, very good. I also remember, again, another student, Dimple. So she is practicing, in collaboration with a physiotherapy clinic. Yeah. So you have tons of opportunities and ways to go about it. And the ways that Huria has listed are very good. Perfect. So what next?
Yeah. So that's what I did. Then I did go for the flyers, okay, because the area around it where I was going for my clinical practice, you have to, go with the flyers. You have to distribute it at different places. You can throw it in the houses, you can ask somebody to throw it in the houses, or you can get the flyers at different shops or different markets or wherever, or at a parlor even, I don't know. So, yeah. So you can do the flyers things. You have to get your visiting cards ready, because you're going to give it to people who are, especially when I did job, it helped me a lot. Why? Because I already had clientage. I already had clients who would come in because they had already been getting treatment from me. And that's why you need to have first a job or an internship or somewhere you had already worked, so that you already have clientage. So when you start your clinical practice, all of them are going to come over there for you. So that's what you have to be sure of. That's why I said that please don't start your clinical practice right after your education, right? Because no screw-ups are going to help in a clinical practice. You have to be doing internships in order to work on your mistakes and everything. And yes, like I said, that please do job before, or work somewhere, work under somebody, take training, and have mentors. Why? Because that is going to help you in getting clientage. When they will like you, they'll like the treatment that you're providing, they will come at your clinic as well. Yeah.
So I want to add here, this definitely holds true again for clinical psychology field. This may not hold exactly true for counseling psychology field. So I don't want you to have this limiting belief that because I've not done a job somewhere as a counselor, and only if I've taken the right skills and trainings. For example, I know a lot of students who have started their practice as a counselor and a psychologist after their masters and getting trained inside PDP. So if you are planning for going towards counseling psychology and that private practice, for that you may or may not have a job. Because I see a lot of students saying that they're not good jobs. One, no jobs. Two, not good jobs. So even if you're not able to get a job, you will still be able to, build a very good career in counseling. All that you need to have is you need to find the right way to gain the skills and expertise. Experience, of course, adds up a lot. For example, it's adding to Huria a lot because she's into clinical practice, may not hold exactly true into counseling. But yes, whatever she mentioned for clinical, I 100% agree that having a job gives you an additional benefit of clientele. What else, Surya?
Yeah. So yes, I would actually talk about counseling as well. If you're, going towards counseling, then online practice might help a lot. Doing PDP, and you can go for then online sessions. That is going to help a lot. Like in my case, when the problems are severe, the disorders are severe, it is difficult to help online a lot. You need to have them in person more. And and you can also do it according to the comfort of the client. If they are comfortable, like I have had patients who had been going after me that I want to have online sessions, even though they're in the same area and they can come there, but they're just not comfortable coming in person, right? So I give them the comfort of taking online sessions first. They can take the first session as their online session, and the second time they can come to the clinic. When they like what they're getting, of course they're going to come over there. And plus, I say that for me, clinical practice is very soothing. Why? Or very, I don't know, it helps me a lot. Why? Because just the fact that a patient going through depression is walking and coming to me, taking a shower is so difficult for them. Imagine them getting out of bed and coming to me for help. How much problem they must be in. So I just think when somebody is walking and coming to me, and I have had plenty of, patients who cancel. Why? Because always know that mental health patients, they have moods, and they might not feel okay sometime. They 1 hour they're feeling very well and they might want to come, and the next hour they might not. So it's okay. Don't think that I'm lacking something and I'm not good enough, or I'm not getting clientage because I'm not good at it or something, or I don't know why people are canceling on me. No, it's okay. They're going to cancel because they're going through mental health issues. Of course, they're not stable enough, or they're not in that zone or in that scenario where they can have consistent mood. They might not have a good mood. I have had clients who are canceling. Why? Because it is hard for them to come to clinical practice. Then I give them the option of going for online, and especially counselors can go for online right after PDP. You have a good degree and then you do BDP and you have the skills, and you can go for the online sessions very easily. Just make a good advertise well, make a good marketing on the page, make a good page, make good content, share what your expertise are in, and then you can start it. Yeah,
absolutely. And now, Huria, after your batch, I think we've now even upgraded PDP, where we are guiding all of our students to build a brand presence. So they are creating their, Instagram page the very first day they join PDP, and we're also guiding them to the content. So yeah, that is also, I wanted to mention. Somebody has asked a question, so I got a little distracted. One very beautiful limiting belief that you have broken for all of them is that, what was I going to say? You said something really nice, and I am into the question. So, what did you mention, Priya?
That you don't need a lot of resources for a clinical practice. Was it that you were going to say you don't need a lot of money?
No, I just think that, now I remember that sometimes clients may not feel well to come to you.
Yeah.
And, that is not your fault as a counselor. Because I see so many people, they say, first session ke liye client aaya, second ke liye aaya, third ke liye they didn't show up. So I tell them that it is absolutely okay if the client didn't show up. It doesn't have to always do something with you. Sometimes it can be, lack of resources on client's part. Sometimes it can be lack of time on client's part. Sometimes it can also be client felt so much better in 2 sessions that they felt that there is no need of the 3rd session.
Yeah.
It's similar to how it goes in medical practice also. Have you not seen your parents not visiting a doctor for months because they're like, we couldn't follow our medicine properly? So not every time it has to be because of you. Sometimes it can be on client's part as well. So thank you so much for breaking this limiting belief for all of them, Huria.
Yeah.
Now that it comes from you, I think we believe in it even more. I do keep telling you.
I've had clients who had done that, who had cancelled last minute. They have cancelled 3 times, and then the 4th time they came, and they're like apologizing, sorry, and then I have asked a few of them that were you feeling comfortable or not, or is there something that you want to mention or anything? And they have told me that we have booked sessions with thousands of counselors and we have not gone to them. Why? Because we just think, how will they be able to help us? Just the stigma that what are they going to do? They're just human just like us, but they just don't understand that sometimes when you're suffering from something, the other person, the psychologist who has skills in it and who studied about it and who's been working in the field for so long, they are going to be able to help you. So just not having the confidence on a counselor is also something that is very common. And that is because of the mental health issues and the struggles that they are facing. It's okay if they're not going to show up someday. Trust me, others will, some other person will. And like I said, you can always offer them to go for online if they are not comfortable in walking and coming there, That might be sometimes very hard for people to come to a clinic and, they be there at person. You can just sit on your clinic and take a online session, and that is going to help them. Yeah.
Very true. So every time you say that, client didn't come to me because I'm not a good counselor, you're doing mind reading, and mind reading is a cognitive distortion. So don't do that. Very true. So somebody has asked a very good question. What if someone screws up in counseling? I want to add to this, and then I'll let Huria add into the same as well. See, screw-ups, it's not that screw-ups will never happen. But please ensure that before you actually begin your private practice, you have the right amount of skills, the training, the right qualification, and so on. And so yeah, skills, trainings, expertise. Once you know all of that is right, and then you are beginning. If you think you are a beginner and there are high chances of you screwing up, you work under someone. You take somebody else's expertise, and then even if you're taking independent cases, you take supervision from someone, so that the chances of screwing up are very, very less. But say sometimes even the most experienced psychologist may screw up, because ultimately you have seen people dying even in the hands of very experienced surgeons. So ऐसा नहीं है that the screw up will never happen. There are chances of screw up happening, but if the screw up happens because of lack of skills, lack of expertise, lack of the right qualification, lack of supervision and training, then that screw up is not acceptable, and that's not ethical either. So I want Huria to add up, what if someone screws up in counseling?
Yeah, I would also say the same. If the screw up is of like a minor level, and that has more to do with you rather than their health, if you're doing screw ups that are going to affect them a lot or going to bring problems for them, then yes, it is a problem. Then you might need to make yourself skilled enough before you go for clinical practice. Like I said, with clinical practice, there's no mentors there to support you or to go to, right? I can, I ask you a few queries, but I can't do it during a session, right? Or I can't get up and be like, let's go to ask the senior person here. No, you can't do that. So be sure that when you're doing this, if you're doing some screw-ups on your own part, or you think you didn't do as much you should have, it's okay. That is fine. You can work on it and do it better in the next session. But if the screw-ups are of this level that it is affecting their mental health or it is going to cause them problems, then it's not a good way to go, I would say. Then I would say that be very sure. Like I was hesitating when I started my clinical practice. I made sure that I did something about it, right? So I came for PDP and I upskilled myself, and I got to that point where I felt like, yes, now I am equipped and I can do this. Because the only thing I was already working with patients and I was already dealing with clients. The only thing I was lacking was that I didn't have enough at my back to support my patients well, or to go about if one thing doesn't work, which is what I got from PDP. And then there was no stopping then I went for it. So yes, it's very necessary that the screw-ups are not of a bigger level, and they're not about your patient mostly. They can be about you or something that has to do with you, and you'll be like, oh, okay, I might have taken a better session next time. These things are fine. You can work on that. Yeah.
Absolutely, very true. I agree with you, Huria. In addition to that, guys, if you think that a certain case, like Huria said, is not under your expertise, please refer those clients. Be very honest and transparent with your clients. That's another thing that can act as your USP, which is unique selling proposition. So, ऐसा नहीं है anybody who is coming here accommodating them. If you think you cannot help somebody the best, please refer them. That way, you're also being responsible and ethical for the entire community. Because if you screw up a session because of lack of expertise and skills, people tend to generalize it. So overgeneralize kar dete hain because that every counselor and every psychologist is the same, and there's no benefit of going to them. So please don't do that. Be like Huria said, ethics, responsibility. So private practice comes with a lot of responsibility.
Yeah.
And you should adhere to the responsibility if you're planning to work in the same. Perfect.
Yeah.
So Huria, I also, what else? Is there anything else coming into your mind when it comes to private practice?
With private practice, I would say that you are yourself the brand. You're walking branding. You're branding yourself when you're walking. So if you're doing good work, more clientage is going to come. If you're going to do screw-ups, you're going to lose clientage and your clinical practice might not work then. So that's why skills are very necessary. And yes, very important. Don't think that you're done and, oh, I had enough skills and now I'm done. No, keep working on yourself. Keep doing more diplomas. I don't know, going for more skills, more certifications. Keep trying to bring the best out of yourself and keep working on it. Because we all know that there's still room for learning and there's still room for doing mistakes. And whenever I face something that I think, oh, this is difficult, this patient is difficult, or this I need to work on, then I go and, I study about it, or I see what I can do about it, what I what certification. Like now I've started DBT certification. Now, why? Because I know that it is going to help with suicide prevention, which I'm not good at, right? And I want to be good at. So now I'm going to work towards that. So in clinical practice, there's no stopping. You can't think that I just started my clinic and I'm earning money and that is it. No. And yes, the amount that you are getting, you have to advertise and post and do a lot of things right with it, with the times. I'm putting standees everywhere to get, people to see it and that I'm sitting over here and I'm working. Then upgrading your skills. Like now, I was not an NLP coach when I started my clinical practice. I just became one. I just graduated. So now I have to incorporate those things as well. So I would say that yes, clinical practice is not easy. You have to keep working on yourself and you have to keep bettering yourself and doing something with it. Yes, and if you are having some clients and like a patient came to me and he said, do you prescribe medicine? Of course, I told them that we don't. We are like psychologists and we don't give medicine. So I told them, you take a few sessions with me and if you don't feel better, I can always refer you to a psychiatrist. And that's okay. If there are patients who are thinking that they need medicine more than your therapy, then you can ask them to take a session or two with them. And if it helps, then great. And if it doesn't, you can always refer them. And that is okay. It's still not you to blame again.
Absolutely. And like she mentioned, guys, even I have spent like lakhs of rupees into my training. And even now, I am also still learning and upskilling. So learning never stops. The moment you say कि मुझे सब कुछ आता है, that day you are going into your comfort zone. That day you are like, I've reached my saturation. And there never has to be a saturation irrespective of which field you are in. So there is always so much more that you can learn and deliver. So I 100% resonate with Huria. Like she's upskilling, I'm also upskilling myself. And similar way, now that you've completed PDP, we are even adding those upgradations to PDP so that I can deliver more to people. So what is their requirement? For example, branding. So now we've added it as a part of PDP itself. So that is very important. Yeah. Somebody is asking a question. Even before this, somebody asked what is the difference between clinical and counseling practice. So, Huria, you want to answer it or would you like me to?
We both can. You can and then I can also go for it.
Okay, perfect. So, the difference between clinical and counseling is in India, you require an MPhil in clinical psychology minimum from an RCI recognized institute to call yourself a clinical psychologist. Once you complete your master's in psychology, you are eligible to call yourself a psychologist. You begin your practice after right amount of skills, training and expertise. Once you're confident, that's when you go about it. But master's gives you that eligibility. Students also do a lot of internships after their masters, etc. to begin, which is the reason we have also started PDP, so that after masters or during your masters you complete PDP, you get the skills and you begin your practice as a counseling psychologist. Whereas clinical another difference is counseling psychologist deals with 90 to 93% of population which is non-clinical in nature. So population dealing with mild disorders rather than moderate and severe. Similarly, we deal with people on a normal end of the spectrum, where there are not much disorders, people suffering from stress, overthinking, anxiety, worry, mild depression, and so on. So that job comes under counseling psychology. And if you would see, clinical population is actually limited, but that requires a special expertise which Huria holds in. So she has an MPhil there, and she's also so she has the eligibility to deal with severe disorders, which I think she is doing and also upskilling herself into. So Huria, now you throw more light on clinical aspect of it.
Yeah, more or less you said the same thing. Like clinical is the severe disorders that we're having, which like bipolar disorder and like with suicide problems or traumas and everything. And with counseling, the thing is that with counseling, it can be everyday life problems. It can be, you had a major incident in your life and you came and you just wanted to overcome it, or you're going through a major life change. Like even if I'm getting married, I would go for counseling. Why? Because I'm going to have a bigger change in my life, right? Or if you're going through some educational issues, or you're going through I'm studying and I'm not doing well and I'm not feeling well. So even from the smallest of the problems where you need direction, where you need a little bit of working and you think you need a little bit of sense of direction, clarity, or you need to work on even the small thing, like you said, overthinking, such a small thing that can become very big eventually. So even if with the small life problems, daily life problems, we can go for counseling. But with clinical, there's a specific population that is suffering through those severe mental disorders, or the ones whose life problems are causing them actually to their social issues and their social life and their daily life is getting hindered by those problems, then we say that they're in the clinical, population more. Yeah, that's what the difference is.
Absolutely. In addition to that, Soumya is asking a question. Can you please give an insight if a client is from different cultural background from counselor? So, yes, Soumya. Generally, if a client is from a different cultural background, if you want to practice with that culture, cultural background actually plays a very important role. So, either you need to study about that cultural background, or you can refer the client to, a counselor with a similar cultural background. So it gets really hard sometimes, especially in clinical practice, when the things that I have heard. So something that you might call hallucinations, maybe, people in that culture might perceive it as, gods and so on. So seeing gods, etc. So cultural background plays a very important role. If you're not clear about that cultural background, please consult someone, a supervisor or so from that background, so that you don't make a misdiagnosis. But again, it's not my place to say, since I'm not from the clinical field. Huria might tell you better. Based on what the knowledge that I have, either take supervision from someone who is from that cultural background, or refer that client. Huria, what's your take on that? What if a client is from a different cultural background than counselor?
Yeah. Like I said, that I had my international client who was going through OCD. He came also with the problem of alcoholism. Now, I am from Pakistan and I am a Muslim. And for me, there's no drinking, like for me, it's haram. So, but I don't go about that, right? I am supposed to help my patient despite of the fact whether he has the same religion as mine or not, or he thinks the same. So if you are capable of you have to know this, that for psychologists, I would say the first thing is that you have to have acceptance of anything that is coming to you, especially when you're working in a clinical psychology field. You have to know that you have to accept them for who they are or what the problems they are coming with. You might not agree with everything and anything they say, but you don't have to agree with them. You just have to help them or accept or have awareness that, okay, they have their own, vision and I have my own, or they have their own culture and I have my own. So I didn't judge him on his drinking, and I helped him with his drinking problem. I'm helping him thinking that it's a bad habit and he wants to work on it. That's it. But if it is like you said, that if it is very religious based, or if it's regarding gods, and you think that you will not, you yourself will know if I can work with this or if I cannot. And if you cannot work with this, the best thing is to refer. But like that person who is over here, like the client I had was from another country, but they're living in my country, right? And they might not be able to get help from somebody who is, from the other country, or a psychologist who is a foreigner also, which is very difficult. So they are coming to you, and if you think you're capable of helping them, you should help them. So you should be very clear that if my ethics and my vision and my perspective says that this is normal, if they have differences from me, then go for it. But if you think that these things are out of my understanding or out of my comfort zone, then don't take it. Then you should refer it. Yes.
Very true. Huria, I love the approach that you took here, and I think it even gave our audience a better perspective of going about it. I also want you to throw light on this now that you're into practice. Sometimes actually counselors start engaging into advice giving. So they start imposing their values on others and all of these things. So I want to understand what is the personal work, the inner work that you have done to reach this place. Because even reading textbooks do not make you non-judgmental or stop you from advice giving. You actually need to work on a lot of skills to do that. So I want to understand the inner work that you have done to reach there. I also want to understand, the personal transformation that you went through inside PDP, because I want to document it on both of our pages.
Yeah. Okay. So I would say this, that I had a client, I'll give you an example, a case study that I had. I had a patient who was going through the struggle whether he should meet the girl or not meet the girl. The girl was abusive. And he messaged me one day, she's going to Sweden, should I meet her or not? Now he's expecting me to advise him, right? And if I advise him, what is going to happen? I'm equal to a friend, and I'm equal to a family member, and I am not a professional therapist or a psychologist. Then why? Because then you will lose clientage because of this. Why? Because when your advice is not going to work, they're not going to come to you. They're going to say, oh, this person does not have good advices. And first thing that I do is when they come in the first session, I brief them a little bit. about the fact that this is a professional setting. I'm not supposed to advise you. I can help you reach to your solutions. I can direct you. I will not be giving advices, because doing this helps me in this way that they're later on not going to ask for it. And plus, it is also going to consciously help me telling myself that, okay, I'm not supposed to advise this person. So I do this. And I've done this a lot of times with my sessions, that in the first session, especially when I ask them, have you had any counseling sessions with somebody else before? Or have you been to another psychologist before? I tell them this is not a solution that I'm going to be providing you, solutions here and you're going to be applying them. I actually tell them that I'm not your friend and I'm not your, I'm not some relative who is going to give you advices and you're going to go and check if this one works or not, right? Because that is not a relationship that you want to build here. You have a lot of friends at home, you can take help from them. So yeah, so that kid messaged me and he asked me that, what should I do? And you know what I messaged him? My reply to him was, what is in your control and what is not in your control? This is what I replied. That is it. I kind of told him that it is your decision, and I messaged him what is in your control, what is not in your control, and that's it. And then he made the decision. I didn't. So I would say that for able to help yourself, it is best that you say it in the first session. That I'm not going, because there's no difference in a friend and then in a relative if I'm going to advise you, right? And to stop yourself, it will help a lot because you have said it yourself in the beginning. It will help you also in your further sessions that you will not be advising. And I even have seen that sometimes they even ask for it, even during the sessions. What do you think? What should I do? Should I do suicide? This is the sort of a patient I had once, and he was like, this is what I'm going through. This is what is happening. You tell me, what do I do? Do I do this or do I do this, or I should do suicide? This is the sort of comments that person was passing. And I was like, will that help you? Do you think this will solve the problem? So you have to give them insight at this point that it has to come from you. It cannot come from me. If it comes from me, then it's not going to fit the purpose, Yeah.
Absolutely. And this is the difference between a trained counselor and a non-trained counselor.
Yeah.
A non-trained counselor may easily jump into advice giving because they're like, हमें तो solution पता है, हम solution एक ही बार में क्यों नहीं दे देते? But this thing actually comes with a lot of skill building and training, and that's when you understand that, advice giving is not something that I can do. Absolutely, Huria. There is one more question in the chat box that I'll take up. Is there any time frame for any therapy, or once it starts, it is up to them to leave whenever they want, thinking they are cured? And as a psychologist, if you know that he or she is not cured, you would still let them go. Okay, so Hadia, let me answer your question. I have created some posts on termination. I'm going to create some more because counselors take termination very lightly. So it is not like कि client ने आना बंद कर दिया तो termination हो गई, or you are not preparing your client for termination and that is called termination. So that is not how termination of a counseling setup actually happens. You need to prepare your client for termination. You set the goals of what your therapeutic what your therapy is in the very beginning of the session. And once you know that those therapy goals are achieved, that's when you start preparing your client for termination. Certain prompts that you can use is, I'm also going to send those prompts on our Instagram page in a few days. That what are your takeaways from the past sessions, and what have you learned? What is the new insight that you've gained? How do you plan to apply this in the coming days? So we prepare our clients for termination because ultimately at the end of the day, this is a professional relationship. Even I had clients that were like, ma'am, friends या guidance की तो जरूरत पड़ती ही है. So they need to distinguish friends and guidance from professional help, right? And you need to prepare your clients for termination. Termination happens once the goals that you set up for your counseling settings in the initial sessions have been achieved. And if the client thinks maybe there is something new, a new goal that I want to achieve, or something else that's bothering me, you can help them with the same. And later on, assist them with the follow-up sessions. But termination does not happen कि client ने आना बंद कर दिया and so on, and that is called termination. That's not the right way to go about termination. Huria, what's your take on it?
Yeah. So I will add this, that first thing I do is in the very beginning, I tell them if, for example, a patient comes and they say that I've had this problem since 4 years. And I say that, do you expect that this problem that has been there since 4 years is going to go in just a 45-minute session? Right? So I tell them this in the very beginning, that it's a slow process. It's going to take time. And if you are going to, stop coming, or if you stop, it is going to affect the whole. And when you come back after, I don't know how many months, you have to start from scratch again. You can't start from exactly where you left. So I do tell them this in the very beginning. I even had a patient who said that I terminated my previous session on my own, deciding that I am well, and now he's here sitting in front of me again. So yes, they are going to go through the same problems again if they're going to terminate it themselves. Yes, we cannot control this, that we tell them not to or we force them not to. But we can do this. We can give them this insight in the very beginning, in the very start. One of the patients also asked me how many sessions, in the first session, he asked me how many sessions will it take? And I said, oh, well, it depends on you actually. If your progress and if you are going to listen to what I'm saying and you're going to apply it on yourself and you're going to take help and you are actually going to come back and give me feedback whether this helped or not. And if it did, then well, we'll be, going slowly and we would know. So of course, every individual is different. You can't have the same, thing fitting for all, and it's not going to work that way. So you have to tell them this in the very beginning, that it is based on every client or every patient, their progress. Everybody is not the same. So it will take time. It's a slow process. If you've been living with it for 4 years, it might not end in 4 sessions. It might take time. So yes, ideally we do say that we have to, in the very beginning, we have to formulate and see how many sessions this. But you never know, in between session they come up with a different new problem that we might not have known about, or they had not mentioned even before. Then that oh no, this is not going to work. So yes, you have to improvise a little bit even in between, but in the very beginning of the few sessions you have to generalize a little bit of a a layout, that this is how many sessions will be needed for this client specifically. Yeah.
Very good. Yes, coming back to, do you have any personal transformation to share, Guria? Maybe something that you have underwent inside PDP, or any insight that you have gained about you as a person, some transformation. If not yours, then some transformations that you've seen inside the program.
My own, so I would say that I had even mentioned before this that I was doing all of the homeworks and I was applying all of the interventions on myself. So it was giving me a lot of insight. It was also helping me in resolving few of my own issues if I had any. So it was sort of giving me a lot of clarity of how things are for me also. And this is where it helped. The second thing is this, that I think that I would say personally, I felt like now I am more how do I say it? Like I know I can look into myself better now. And I know when I am being judgmental, or I am being wrong, or I am going through negative thinking, or I am using a self-limiting belief. I can identify those. I can identify my own language more, like, okay, this is what you've been saying and this is what you've been feeding to your own self. So I can identify that, and it has helped me a lot personally. It has helped me a lot with my relationships as well, because I have seen my relationships in a different light before. Like I was doing this with my own self, that I was looking at all of the negatives of my relationship. This is what we all tend to do. We look at our own positives but the negatives of the other person. So through positive psychotherapy, I learned that, I remember there was a task or an intervention that we did where we were supposed to look into the good things, or the good things going right in the relationship, any relationship, whether it's with your father, mother, or whoever. And when I did that exercise, I was like, this is brilliant. Why? Because you're always looking at all the things that are going wrong or which are not right, or some, like we're focusing on that. So I would say that I became more positive. I do think so. And I was able to identify whenever I was using a self-limiting belief that I can't do this, I can't do that. So that then even you taught us manifestations, which I've been doing now. I make manifestations. So what is the next step I want to do? So these small changes have brought a lot of very positive changes in my life. So yes, personally, of course, there's personal growth. I've groomed myself through those skills. I have worked on my own personal problems through them, and which is great. And I have seen a lot of people in PDP from the day one to last day, the people who were not talking in the beginning, and then the last day, and they're so fluent and they're talking and they were so underconfident. And I've seen so many of, I don't want to name any of them, of course, but they were doing so well. And in the beginning, they were so shy, they would not even raise hand to ask questions. So I've seen a lot of people grow and work on themselves during this. And I think And I really like this about it that, in PDP, we all are sharing a lot of personal stuff as well. Everybody is like a family and they're all keeping your stuff so safe, and it feels like very good, and it feels like that this is teaching us ethics on its own. Because when you're going to work with a client, it is going to teach you ethics that you're not supposed to let out somebody's personal problems. And that is itself a very good thing, I would say. That when you're sharing, we know that we are not supposed to share this. So we're learning ethics even in PTP. Yeah.
Very true, Huria. And thank you so much for sharing this. Finally, some last words for anybody who wants to begin their private practice in counseling.
Like I said, it's not going to need you a lot of, like a bank balance back there. No, it is going to need good skills. It's going to need enough education that you've had in the field. And you have to be sure, like I said, you have to be very clear of your niche. You need to know where are my expertise, where I am good at, what are the areas that I'm good at. And then it doesn't matter whether you end up, sitting at a wellness center and there's your clinic, or whether you have a very separate clinic, or whether you're sitting at a hospital. It's not going to matter. Your work is going to matter. If you're doing well and if you're helping people and that is bringing results, it's going to work anywhere you are. It doesn't matter. So be aware of, this is the location I want to work in, this is the area I want to work in, and just keep upskilling yourself. Clinical practice is not as hard it seemed. Even for me, when I was starting it, I was thinking, oh, how I'm going to do it. The only thing I realized I needed was probably skills. I just needed something that I could rely on when my patient is coming and I'm not freaking out, how will I help them? That's it. And then the resources, like we say in NLP, we all have the resources. We just have to look in and find them. So I think they're always there. It's just that and take baby steps. Don't always go for the last goal. This is my last goal. This is the clinical practice. I have to go, no, don't look so far away. Look at the next step that needs to be done. And that's what I did. I looked at, okay, I think I'm not confident enough. I don't have skills. Okay, let's go for PDP. That's the next step I took. Right. And then I was like, okay, now what do I need to do? Maybe I need to formulate an Instagram page. Okay, I did that. This is how I took. So take one step at a time. Don't look at the last vision or the last thing that you have to achieve, because that is going to seem like so difficult and you're going to freak out. How will I get there? No, don't worry about the last bigger picture is not necessary. The baby small steps that are going to get you there is what is necessary. So don't freak out. It's not a big thing. I think it is very doable. Yeah.
Thank you so much, Huria. In addition to that, any last words for anybody who is looking for help, mental health support from you? So why should they approach you? Though they have, I'm sure anybody who has seen our entire video, they already know if they connect with you. But I wanna, anything that you wanna tell them about your approach as a clinical psychologist or something, and how and why they should connect with you.
All right. I would say that, when clients come to me, I tell them I've been to therapy myself as well. So it's not a stigma anymore. It is not. If you're going to make it one, it will seem like one. Don't worry about the people who are around you. We need to save ourselves first, and then maybe we can help somebody else. And I have been through it myself. I've gone through therapy years back myself as well. It is a very normal thing now, and it has to normalize now, because our everyday challenges are sometimes so hectic or and we are unable to cope with it or take such a toll on us that it's okay to go for therapy. And the people who want to come to me, I would say that I think I am very open-minded as a psychologist, and I have been a very judgment-free sort of a person, and that has helped me become a very good psychologist, I would say, because I think that when you are judgment-free, it opens space. And I think that I work with the client looking at what they are capable of and what I need to make them do in order to become more capable. Like I said, the resources are there, they're in them. We just have to bring them out. So I think that I would say who are trying to come to me, they should know that it's an open space. There's no judgment. And I think that I would tell them very honestly if I will not be able to help them. I will tell them that this I might not be able to help you with. I'm not going to give you false expectations or false hopes. I'm going to be very true to you. And I'm going to tell you this I can help you with, and this I might need to refer you to somebody else for. So I think that the people who want to come to me, they would know that whatever they're going to get is what they're seeing on my page probably. There's not going to be any or the other side to it. It's going to be very transparent, I would say. So if they want to come to me, it's a very transparent process according to me. And of course, the privacy is always first. So don't worry about it. It's a judgment-free space, and I'm very open-minded to, like I said, even if they have religious differences, I have come across this that I don't mind having religious differences even. And I have gotten to realize this about myself, that I'm okay if somebody is not from my religion or they don't see things how I see it. It's very much normal. And that's why I say that I'm a very judgment-free sort of a psychologist. And I'm okay if you are doing anything that resonates with you and maybe not resonates with me, and I'm very open to that. Yeah.
That's beautiful, Huria. And I'm sure everything that you have mentioned in your USP is very much clear with the conversation that we have had in the last 1.5 hours. So that's very true. And Huria, what would you say to anybody who is an aspiring counselor and is on the fence to join PDP? So based on your experience that you have had inside PDP and what you witnessed with your peers inside PDP, what would you say to someone who is on the fence to join PDP?
I would say that don't hesitate at all, because not only, learning these techniques and everything, the things that I got to hear from everyone, the peers, and they were so skilled and they knew so much, and I had so much exposure, and very, I would say this is very necessary. I still have that family with me. I can still refer to them. I can still message them. I can still ask for help. I can still ask you for a query. I can still ask that group of people that I had as my classmates, and I can still message them, and they would give me instant advice. They would provide instant help, and it becomes like a family, and which you need. As a psychologist, sometimes you yourself need somebody there or a group there, a support system, which you get through PDP. And I think that's brilliant. When you're practicing or working, sometimes you need help with yourself or with your client or anything you need to study material, anything. Everybody's jumping in and helping you out. And that is great. Plus, in PDP, I would say that it helped me in so much of self-awareness and personal growth that even if it was not for the purpose of professional, enhancement, it was still a great means of having personal growth, having insight, having self-awareness, and working on my own problems. I saw all of us working on our own problems as well, which was brilliant, because we were helping ourselves, and then we were able to help others as well. So I think it is like a bonus. You can help others, but you are also helping your own self. So I'd say don't hesitate taking this. First thing that I have noticed, it's not even costly. It's not like, oh my God, I have to pay this much amount. It's very, very, doable for everyone. It's not that expensive that you can't take it. It's so, easy to pursue. So I don't think so one should hesitate. And the amount of skills you're getting in that money, nowhere else you're going to get. So I think you should definitely go for it. And trust me, it's going to be like you're going to see changes in your own self after a while. You'll be like, I think I am doing better myself as well. So I think everybody should go for it. It's going to give them a lot of help, career-wise, personal, everywhere.
Absolutely. And you've already mentioned so many techniques that you're already using from PDP. It's helping you as well as your client, which makes me very proud.
Thank you.
Perfect. Any last words from your end without me actually asking any other question? Anything else you want to tell anybody, your message to others?
My message to others is that I want to just thank Vishali ma'am for such a great experience and such a great learning. And she's still there for me always. And she's just one message away, which is, I don't know how much that means to me. And you're like a mentor to me. And I was always remember that you were the one who gave me that kick that go start your, work in your clinical practice. And I would say that just work on mental health and spread awareness and take this PDP course, because it is going to help you in your career so much, and it's going to boost you so much that you will be, very happy at the end of the day. And thank you to you for even inviting me here, and thank you for this whole, gem of an experience, a life-changing experience I had, and great learning. And thank you for all of the support and help that you've always given me.
Thank you so much, Huria. I think it was so lovely conversing with you. There are so many messages, in the chat as well. It was a nice session. People are saying it was so informative and good session, which is very motivating. I think I should invite you even again. Is there any roadmap for counseling? So, Piracha, I'll write you about the same. So, first, I want to thank Huria. You've been an excellent guest, Huria. I think anybody who needs help in counseling, so I always direct them to these live sessions that we are having. I ask them that you go there, you see the energy of the counselor. Because they train under me, I know the level that they have at present. So, anybody who resonates with you and connects with you, I don't think that they'll have to even have a second thought about connecting with you, and they can connect with you right away. Thank you so much. I think you even imparted a lot of valuable experience of yours to all of them. Anybody who wants to begin their practice, or anybody who is even looking to seek help when it comes to counseling. So thank you so much for your time. It means a lot. I want to invite you again. Maybe we can discuss more topics and come forward again. Maybe if not on Fridays or some other day, whenever you are available.
Yes.
So that would be lovely as well. And thank you so much, Surya. In addition to that, is there any roadmap for counseling? So, Piracha, we are doing a 3 days free webinar, free workshop series on 15th, 16th, and 17th of this June. The link of the same is in our Instagram bio. You can check that, and I would love to see all of you joining for that matter. So I'm sharing the roadmap for counseling that Huria and so many others have followed, and which you can take up too, and that should help you. Perfect. With that, we'll call it a day.
Okay, take care, everyone. Bye bye. Had a great session. Thank you, ma'am.
Thank you, Huria. Thank you so much. Bye. Have a good day. Have a good day, everyone. Thank you for listening to us. Bye.
Bye bye.